two speakers, Dr. Muna Al-Umaira and Dr. Marwa Al-Bahrani. Dr. Muna obtained her doctorate in dental surgery in 2005 from Virginia Commonwealth University. She's a diplomat of the American Board of General Dentistry and a member of the Faculty of Dentistry of the Royal College of Surgeons in Ireland. In 2013, she obtained her professional doctorate degree in pediatric dentistry from Leeds University. Currently, Dr. Muna Al-Umaira is a pediatric dental specialist in Jabal Ahmed Dental Specialty Center. Dr. Muna Al-Bahrani is a pediatric dentist working in Farwaniya Dental Specialty Center. She also works in Sabah and NBK hospitals and Fahihil School Oral Health Program. In 2012, she obtained her bachelor's degree from Manchester University. In 2015, she had the MFD from the Royal College of Surgeons in Ireland. In 2017, the professional doctorate in pediatric dentistry, and in 2018, she obtained her diploma of membership in pediatric dentistry. Please welcome our speakers.
Assalamu alaikum everyone. I am Dr. Marwa Al-Bahrani and this is Dr. Muna Al-Umaira. We are both pediatric dentists. Inshallah, today we will talk about management of medical emergencies in the dental setting. But as the title suggests, we're not going to discuss management of specific medical emergency situations. I am not going to tell you how to manage anaphylaxis. I'm not going to tell you how to manage hypoglycemia. We will discuss something that is often missed, and that is how to apply this as a team, the organization, the communication between team members, how to make a protocol, and how to train your staff. I'll leave you with Dr. Muna now.
Assalamu alaikum. Hi, everyone. So I will start by telling you a short story about how we got involved into all of this. One day I was called to help manage a medical emergency in one of the dental clinics. The patient was stiff, eyes wide open, they were breathing rapidly, but I couldn't help but notice there was no crash trolley at the scene, even though emergency started minutes ago. And the center is equipped. When I asked what happened, I was given a lot of information from different staff members in no specific order. It was like a puzzle. I was trying to piece the information together. Eventually, the clinic got really crowded. Everyone was trying to give their opinion on how to manage the patient. It turned into a discussion rather than actually actively managing the patient. When the crash trolley got in, one staff member was looking chaotically through the drawer, trying to figure out where the equipment and materials are, while another was trying to figure out how to operate one of the medical equipments. On the other side of the room, the family member accompanying the patient was asking questions. They were getting panicky and even got a little bit aggressive. Luckily, in the midst of all of this, someone called medical emergency services. But when they arrived, they were delayed to the scene of the emergency as no one was there to guide them. We were located in a large center with multiple entrances leading to different parts of the building. It wasn't as straightforward as you would think. Now, I can tell you that thankfully our patient is fine, nobody was harmed in the telling of this story, but I couldn't help but think, this is chaotic. A lot of time is being wasted. Omissions leading to mistakes can easily happen. Wouldn't it be better if we had a protocol to help solve some of these issues and maybe some more? And this is when we set our first medical emergency protocol in the school oral health program, which we will tell you all about. But now, what is our aim for today? Our aim for today is to give you the building blocks to formulate your own customized medical emergency protocol that is specific for the dental setting, which in turn will ensure a fast, organized, and appropriate response. Now, I don't know about you, but I think this is a very crucial part in the management of patients. As dentists, we do have medical limitations. The least we could do is be fast and organized. Time equals life in these situations. Now, these are the suggested components to consider when you're creating your own protocol. Each one of them is customizable, but please consider every one of them, and we will take you through them one by one.
So the first step into making a guideline, a protocol is to adapt a guideline. And this is just to make sure that everyone in the team is on the same page. Of course, you can make your own guideline, local guidelines, or you can adapt an international guideline. There are many international guidelines that are available, the American Academy of Pediatric Dentistry, the SBCEP as well. Guidelines do get updated regularly, so whenever there is an update, please ensure you update your staff on whatever changes. The guidelines need to be printed. You need to place it in the emergency kit, and it's always preferable to send your staff a copy electronically as well. Now you know what are you going to do. The next step would be to prepare your emergency crash cart or trolley. You want to prepare that. Have a list of drugs and equipment. It's just to make sure your staff know where to locate everything. And then you want to develop a system to regularly check on the equipment and medication. These are just different pictures of crash trolleys and kits that we have prepared in different centers. You can see it does not have to be something fancy. You can work within the space you have as long as the medications and equipments are organized in a way that can easily be retrieved during an emergency situation. Where are you keeping these? Always make sure in your protocol you include an exact description on how to get there, how to get the emergency crash trolley. Be very specific with your description, and it's always very useful to use pictures and illustrations. And the last step would be to train your staff on how to use the drugs, the doses, the roads, how to prepare them. You want to show your staff on how to use every and single equipment in your crash trolley, even if you think it's simple or silly. Of course, if every time you get a new equipment, you need to make sure your staff are introduced to the equipment. If you have any instructions manual, again, make sure you keep those. Please don't throw these away. This is the picture from Hawali, School Oral Health Program protocol that we have created, me and Dr. Muna. And always in our protocol, we would include a written description along with the pictures and illustrations. Sometimes some of the equipments are not placed within the emergency cart. They are placed elsewhere. So please make sure you highlight this in your protocol. Same thing with the drugs. Some drugs are kept in the fridge. Again, you want your staff to know where everything is located before they get a medical emergency. You don't want them to waste time trying to find things during an emergency situation.
Now that we are prepared, we can tackle the emergency as a team. The emergency needs to be managed at the site of the emergency by the closest 3 staff members. Now, you can recruit more if you need to, but make sure no other is present at the site unless needed. Also, keep in mind the patient's well-being is the most important thing. So if you need the help of somebody who is more experienced, or you think they can give you good advice on how to manage the medical emergency, you can recruit them. Just please do not delay the management of the patient. The patient is your own legal and ethical responsibility. Now, who is member 1? Member 1 is the first staff member at the scene, the leader, usually the dentist in our case. Their main role is to manage the medical emergency, assess and manage the patient. Please stay with the patient at all times and do not take it lightly. Patient can lose consciousness and suffocate with their own tongue, or they can develop a cardiac arrest, in which case you need to be able to perform basic life support as soon as possible to increase the patient's survival rate. There is really very little need for us here to leave the patient site, as we usually work in pairs. Also, as the leader, the member 1 can instruct and direct other team members, prescribe and administer medications, perform or initiate the basic life support, and brief the emergency staff when they arrive. Also, if there is a need, they can accompany the patient to the hospital. Member 2 is usually the nurse helping you taking care of the patient. Now, their main role is to help member 1 in the management of the case by bringing the crash trolley, enlisting the help of the 3rd member. They can prepare the prescribed medications and assist with the basic life support, as well as take and monitor vital signs. Member 3 is any staff member, the closest staff member to the scene that can be recruited. Their status here does not really matter, as their role is mainly supportive. They support member 1 and 2 to allow them to focus on the management of the patient. By calling the emergency the emergency medical services and arranging with the reception and security to escort them to the site of the emergency, right? They can also record vital signs and the events as they happen in a chronological order. Comfort family members, they can take care of that for you, right? Enlist the help of more staff members if you need more staff members, and help with the basic life support. And as we've mentioned before, you can have more staff members. Is it working? Yeah. You can have more staff members, just make sure to give them their specific roles. We don't want the scene to be crowded for no good reason.
As Dr. Mona discussed, the team approach, and because there are so many individuals involved in the patient's care, you want the communication to facilitate the patient's management. You don't want miscommunication. Miscommunication can cause errors, it can cause mistakes, and these mistakes can be vital sometimes. So in this part of the presentation, I will be talking about the communication part. In other words, team dynamics. What to communicate and how. So what to communicate? What are you going to communicate someone who just joined the team? Or the paramedics when they take over the care of your patient? ISPAR is a very helpful mnemonic to improve the safety and the transfer of critical information. Who is the patient? What's happening with the patient? Any relevant medical history? What are the events that happened prior to the situation? What are your assessments, your findings? What did you do to help the patient? And the last thing would be your recommendations. What are you planning to do next? Evaluation. Evaluation, of course, is a continuous process. You don't just do it one time and that's it. And every time you evaluate the patient, you want to make sure that your staff are aware of the updates. So how are you going to communicate this? Closed loop communication. You ask your nurse to call the EMS, for example. Your nurse has to repeat the request. I am going to call the ambulance. They go back, they call the ambulance, they have to come back to you to confirm that the task has been done. Closed loop communication. You have to give clear, precise, and correct messages. If you don't understand something, please ask them to repeat it. You should have mutual respect. If you are going to correct someone, please do it respectfully. You don't really want your staff to fight on top of the patient who's having a medical emergency. Any person of the team should stop someone else from making a mistake, regardless of that person's role in the team and their seniority as well. On the other hand, if you are the one being corrected, please don't feel offended. It's not personal, at least it shouldn't be. It's all done for the best interest of the patient.
Now we come to dealing with family members. In dealing with family members, it's always a good rule to have only one family member at the site of the emergency to reduce the fact that they could feed from each other's fear. Be understanding, compassionate. They will be panicky. They will be worried about their loved ones. But if their behavior is found to be hindering the management of the emergency, then you need to escort them out. Tell them why. They only want the best for their loved ones. But you will be faced with few that will be aggressive. In that case, you need to have very clear policy on how to deal with aggressive family members, depending on your area of residence, depending on the center that you're working in. For example, where I work, the security staff member will come in, they will escort them out. The head of the center will take care usually of the problem, again allowing you to focus on the management of the patient. Infection control is a component. It's part of our day-to-day life, right? It's just in there to remind you that we still need to practice infection control during emergency. Take care of yourself before you take care of patients, right? Keep your staff updated with the most recent guideline available, especially in situations such as the pandemics, and make sure they know how to handle the medical equipment, what needs to be sterilized, what is disposable, according to the manufacturer's guideline. And now we come to the handover process. In the handover process, you're moving the patient from your care to the emergency medical staff care. Brief them with the patient's condition. The time of the handover needs to be recorded. Also, the name and signature of the person taking over needs to be recorded or needs to be on record. Of course, it would help if we had a form to add all of this information in an organized manner, which we've created, and we've called it Medical Emergency Chronological Record Form. It contains the patient data, followed by their initial vital signs, then the events as they happen chronologically, the name of the staff members that were involved in the management, and finally the information of the handover process. This form is important for educational purposes. It's important in case there is any legal litigations. Everything will be clear to protect you and protect the patient. And also it could provide invaluable information to the medical staff. Now we can say, congratulations, your emergency is finished, but you're not. There's few last things we need to do here. First of all, we need to inform the person responsible for the medications and equipment so they re-sterilize and stock. Also, in the Ministry of Health, we are required to fill an incident report form. This is usually filled by the staff members involved in the management of the emergency. And finally, it's always a good practice to take it as a learning point and discuss it with all staff members, taking back constructive feedback to improve on the patient quality of services and care.
The journey. We discussed how to make a protocol. We're going to share a little bit of our training experience now when we made our first protocol and how we ended up training more than 400 staff members in the school oral health programs across different centers, 5 different centers. So it was our first time doing all of this, and we needed to consult someone who's very experienced in the field. We made our first version and sent it to Dr. Malamed. Professor Malamed is a dentist anesthesiologist. He's professor in the Austria School of Dentistry. We sent him our first version of the protocol that we made, and we were actually very surprised to see that he was very happy with it, and he thought it's the best he'd ever seen. After that, we got our green light from Dr. Dalia Al-Hannawi. Dr. Dalia Al-Hannawi, she's the former superintendent of the school oral health program at the time. The plan was we apply the protocol to all the different centers in the school oral health program, which we did. So in a 2-month period between December 2020 to January 2021, we trained for 144 staff in 5 different school oral health program centers. And by staff, I don't just mean dentists. Dental assistants, X-ray technicians, even the reception staff had their own training. They have their own role in the medical emergency situation. And believe it or not, reception staff are very valuable if you give them the proper training. These are the centers that we have trained: Al-Jahra School Oral Health Program, Barak Al-Kabir, Hawali, and Ahmadi School Oral Health Program, which has 2 centers, Hihil and Sabah Al-Ahmed. Some of these centers shared the building with the medical team. So the protocol that we made, it was actually a joint protocol between us, the dental staff, and the medical team in the building. And we were actually very happy to see that the medical team are very willing to help. On our day 1, we would introduce everything we plan to do to the head of the center, inspect the medical emergency room, organize a plan for whatever is missing to be requested, finalize a policy that is customized to that center, and then we would divide these staff into small groups, and we would send them training pack. Training pack, I mean everything we think that would be useful to them. Average vital signs, manuals for how to use some of the devices, such as the AED, videos, etc. This is the Jahra emergency room, and this is Sabah Al-Ahmed. This picture is taken from Hihil School Oral Health Program, and just to let you imagine the building, this is a very old building. It's got 2 floors, a bottom floor, a ground floor, and the first floor. The dental clinics lie within the first floor. There is not enough space to have an emergency room on the first floor where the dental clinics are, so the main emergency room is within the ground floor. There are many ways in how to go to the elevator from the dental clinics, and then from the elevator in the ground floor to the main emergency room. And you can see these little yellow signs here. These mark the shortest and the quickest way to go to the emergency room on the ground floor. We actually timed that before placing these signs. This is the main emergency room in Fahil School Oral Health Program on the ground floor. It is fully equipped to start PLS, ACLS in case it's, pulse as well in case it's required. And as I said before, reception staff do have a role. If you give them specific tasks to do, you can see these are written in Arabic, in a language they can understand. The one with code blue is from Fahil School Oral Health Program, and the other one with the red banner is from Sabah Al-Ahmed. You can see you've got two different phone numbers. You've got the EMS, the 112, and another number. If you ever have two different numbers, so the direct number for the emergency staff, for example, please call 112 first, or the emergency number in your country. That's because the calls are recorded, and if anything happens legally, you will be protected, and the patient, of course, also will be protected. If someone is going to call emergency services, then there are some specific tasks they have to do. And these tasks are explained nicely in this form here that we have created. What time they call the EMS, what time they picked up, time of arrival. If you've got multiple entrances in your area, in your workplace, you want to make sure that security staff know that you are expecting paramedics. You want to make someone wait for them at the door, accompany them to the emergency site. So the training, we would do it usually in the emergency room at the center. We would show them the location, the component, as we explained how to use each and every single drug and how to use each and every single equipment. This is the crash trolley. Our training in one of the centers, our training was so detailed that it would show them how to lock and unlock crash trolleys, how to release the brakes. And there are different versions of emergency crash trolleys in different centers. If they had a bed stretcher, then we would show them how to use it, how to release the side rail, etc. And I know you might think it's something very simple, very silly, but during an emergency situation, you don't want your staff to try to figure out how to use things. It will waste time, and it will look unprofessional as well. This is from Fahil School Oral Health Program as well. It's a very old building, and there is no way you can have communication using landlines in this building. So they had walkie-talkies. These are high-frequency walkie-talkies that require special approvals by the Ministry of Interior, which was done by Dr. Habab Al-Mazidi, the head of Fahil School Oral Health Program, and Sabah Al-Ahmed. So even those, we did explain to the staff and included in our policy how to exactly use these walkie-talkies, what buttons to push, and what information to deliver.
Now that the staff members are ready and the center is ready, we can move the staff members into a clinical setting where we practice some drills. During the drills, the main aim is to get the staff member to understand the team formation in their own environment. Also how to access and use the information given to them. We use two scenarios, the anaphylaxis, which we took it all the way to cardiac arrest, just to give them the full spectrum and how to move from one to another management. Also, we use the hypoglycemia, which is one of the most common medical emergencies in our settings. And to ensure the continuation process in that center, we generated a training folder. The training folder contained a copy of the training material, everything we told them about, how to use the medication, how to use the equipment in writing, so they can review it anytime they want to. Also, there was a copy of a tailored local emergency policy for that center, as well as the form they would need to use during an emergency. All the staff members that received the training signed that they've received it, and a copy of that was included in the training folder. The main purposes are to make sure that all the staff members have received it. Any staff members that have not received it, we can go back and give it to them using the training folder, and to be able to generate an annual schedule, depending on how many times you want to do it. Every 2 years, every year, every 6 months, to revisit it for the staff members. And also, we recommended that there will be a reinforcement process. The reinforcement will be in the form of conducting random assessments for the staff members.
Just to add on that, a very good example of reinforcement happened on Sabah Al-Ahmed, where we worked very close with the emergency physicians, Dr. Nawaf Dihrab, Dr. Mohammed Sanad. These are very busy people, but they still managed to spare some of their time to help us doing unannounced drills, where we would ask a patient or a parent to fake a medical emergency situation, and then we would see their performance and give them feedback from us and the emergency team. Thank you very much. Any questions?
Yes, thank you both, doctors, for this interesting lecture. It is really useful, and I think we face it every day. So, any question from the guests? Okay, no question, but I have one. Yes, I want to ask, how often do you recommend to check the emergency kit, like to update it or to check the drug expiry date? Is there any guidelines to check it, how often?
There is no guideline that I know of right now on how often you should check it. This will depend on your center. That's why we're saying everything we're saying in here is to be prepared ahead of time. We don't want to be put in a situation where you're trying to figure out something on the spot. So we sit down, we devise based on how many staff members you have, how many personnel can take care of this, and we generate a schedule.
Okay, thank you, very clear.
Thank you.
Yes. Yes, please, doctors. We like to give you this something. Yeah.
مشكورة حبيبتي. مصور؟ بس يلا. أحمد قاعد يصورنا. يلا. وين ماكو مصور؟ خلاص ما لازم. مشكورة حبيبتي.